Okay, welcome back, everyone. Today we're going to talk about diseases of the world, and you're going to do an activity where you'll have patients that have different symptoms, and it's your job to diagnose the patient. So make sure that you're listening. All right, so first of all, let's just review some really quick vocabulary. These are words that a lot of you may be familiar with, more so than students in the past have been familiar with, just because of our pandemic. So it says, what's the difference between an endemic, epidemic, and pandemic disease? So an endemic disease, which is what COVID is becoming, an endemic disease is one that is just always kind of in the population, but there's not like lots and lots and lots of people sick with it. It's just something that's sort of ever present. An epidemic, look at the diagrams because I think they're super helpful. An epidemic is when you have a local outbreak, where you have an outbreak where lots of people get sick in a small area. A pandemic, which is what we've been experiencing, is where the entire planet is getting sick. Epidemics are happening all over the planet of the same disease. That's an example of a pandemic. And then a couple other words that I just want you to be familiar with. An epidemiologist is a scientist that determines the cause of a disease. They determine who's at risk and how to fight and control it. So those are the doctors that help us sort of stop these diseases. And then patient zero is what epidemiologists will often look for. And that may be more than one person. It might not be just one person. But they're trying to figure out, where did the disease first show up? And so lots of times diseases come from animals. And so if we figure out who the first people are to come down with these diseases, we can figure out where these diseases are sort of hiding in animal populations. And then we can figure out ways to limit our risk. How do we stay away from those animals, or how do we whatever we can do to make sure that we prevent that situation from happening again. All right, so let's go ahead and talk about some of these diseases. And why is my thing not moving forward? There we go. Okay, I mentioned tuberculosis earlier. Tuberculosis occurs when we breathe in bacteria of infected patients, and it leads to bloody coughs, fever, tiredness, and unfortunately death. I said earlier something like 1 in 4 people around the planet is infected with tuberculosis, but many of them are not showing symptoms of it. So about 5 to 10% of people who have tuberculosis are actually going to show symptoms, and many of them unfortunately will pass away. So it says some forms are immune to all known antibiotics. We've had tuberculosis on this planet for a really long time, and we've been giving people antibiotics for it for a really long time. And so many people that many of our antibiotics are not working anymore because people have misused the antibiotics, or some people with weak immune systems have been using the antibiotics and whatever. Okay, so 1 in 4 adults are infected. And then, I'm sorry, I had one more note here. 1.5 million people died from it in 2020. And it shows you sort of the cases where they're most likely to have tuberculosis. So the darker colors are where people are more likely to have tuberculosis, but it's everywhere on the planet. All right, kind of a gross photo here, sorry. Diphtheria is a highly contagious bacteria that's transferred by touch or by breathing in the secretions from an infected person. And the primary symptom is sore throat. There's a low fever and a yellow or white membrane on the tonsils and or nose. Most of you would have received what's called the DPT vaccine, diphtheria, pertussis, and tetanus vaccine, which makes it almost unknown in the United States. So we don't get diphtheria very often. All right, next, what I should have mentioned, just in case some of you get uncomfortable with seeing medical photos, there are a couple of kind of gruesome photos, not very many, but there are a couple kind of gruesome photos in this. All right, so polio is a highly contagious virus, usually transmitted through contact with feces, so poo. Well, who comes in contact with poo? I don't. Actually, you do. It turns out that, like flushing toilets, it sprays, some of that water sprays up. And if a person, which almost nobody has polio anymore, so it's not an issue, but if somebody had polio and then you walk into the bathroom after that, there could be spray, or it could be from many areas of the world have very they don't have good sanitation as we have in the United States. And so sometimes people are bathing in the same places where they're collecting drinking water. And so that's a place that infection can occur. So most people, just like with COVID, most people have no symptoms. However, 1% of the cases lead to weakness and paralysis, which means they can't move their arms or legs, or both. And some of them can't even breathe. And I'll show you that in just a second. It's prevented with a vaccine, and we have almost wiped out polio on this planet. There is almost no polio existing anymore. Remember, we wiped out smallpox with a vaccine. Well, polio is right around the corner. This is a really kind of a depressing image of United States. The structures that you're seeing here, they're called iron lungs. And if you look carefully, there's a human head sticking out of each one of these iron lungs. These are usually children. Polio was more likely to affect young kids. And basically, they couldn't breathe. And so they were put in these tubes, and the tubes would press on their lungs, and it would cause them to force air out. So it would go, and then it would release, and the kids would go, and then the machine would press on their lungs, and then it would release. And that's the only way that they could breathe. They were paralyzed, so they could not ever go hang out with their friends again. Nothing wrong with their minds, but they were trapped in these machines until they died someday. Some of them lived 40 years in their machines. They had a mirror usually up at the top so that they could look at a visitor or a nurse that was walking by. But that's how they spent their lives, was in these iron lungs. This is an upgrade, so to speak, of the iron lungs. They were able to put, so that it took less space. They actually had these iron lungs embedded in the wall, and then these kids spent time. This is a real photo, ladies and gentlemen, as ridiculous as it looks. It's kind of horrifying. And so these people spent the rest of their lives in these iron lungs. And then this is the sort of most recent version of the iron lung. It's a smaller version. And so this man is paralyzed, and he has this machine that pushes on his lungs to help him breathe. And she's showing that they had a vaccine that cured polio. It just makes me sick how people responded to the COVID vaccine, because we have used vaccines to wipe out smallpox and almost wipe out polio. Vaccines are our friends, you guys, that we don't have to live with this kind of stuff. So I don't understand why anybody would not want a vaccine. But all right, cholera. Cholera is a bacterial disease, and we get it from drinking infected water, but we almost never have that in the United States. We have extremely clean drinking water here. But unfortunately, it happens in areas where people are living in poverty, and it leads to lots of watery diarrhea, vomiting, and leg cramps. And you may not realize it, but people die of diarrhea all the time. That's one of the leading causes of death around our planet. You lose so much fluids in your electrolytes. Eventually, the heart stops because people get so sick from it. So severe cases can cause death in just hours. All right, next is Hantavirus. Hantavirus comes up in the news every once in a while because it's quite scary, but extremely rare. It comes from contact with infected mice or rats, usually in the southwestern United States. We usually don't get it in northern states like Minnesota. It starts with a fever and muscle aches, then leads to coughing, shortness of breath as the lungs fill with fluids. It's a hemorrhagic disease, which means that people start bleeding, their lungs start bleeding, they start coughing up blood, and 38% of people who develop it die. So that's a much, much higher death rate than most of the diseases that we're familiar with. So that's hantavirus. All right, next is influenza, and that's the fancy name. That's the correct name for the flu. And sometimes people think flu is something to do with your stomach, and that's what we call the stomach flu, but that's completely false. The stomach flu is usually from eating contaminated food. So something's wrong with the food that you ate, and then you get sick from it. There are viruses that cause the stomach flu, but again, that's not the same as influenza. Influenza is really a lung disease. So it's a virus that mutates very often, and sometimes the mutations are mild. Some years, nobody dies, or I shouldn't say nobody, very few people die from the flu, and other years we have pandemics of flu. So this was the pandemic of 1918. It affected, COVID affected more older people, whereas the flu pandemic affected young adults. So the primary people who died were between, I think, 18 and 30 years years of age. That was the majority of people who died. It starts with fever, muscle aches, sore throat, dry cough. Usually the elderly and the young are the ones that are at greatest risk for the death for any given year. But in this example, with the flu pandemic of 1918, it was middle-aged or young adults that were most impacted by that particular disease. Because it mutates so often, we make flu vaccines yearly, trying to sort of make sure that we are ready in case there's a bad mutation of the flu. All right, malaria is caused by a parasite. We haven't talked about a parasite yet. This is a parasite that's carried by mosquitoes. So parasites are closer to animals than they are to bacteria or viruses. And then the mosquito will collect a parasite accidentally. It's not doing it on purpose, and then transfer it from one person to another. And it's usually in tropical areas of the world. The mosquito that carries malaria doesn't live in cold weather, so we don't have them. It leads to lightheadedness, shortness of breath, fever, chills, nausea, and flu-like illnesses. It can cause pain and vomiting and organ damage, and some people die. So in 2020, there were 241 million cases of malaria, and about 627,000 people died. That was in 2020. We didn't really hear much about malaria because we're so focused on COVID, but I want you to understand how many diseases there are out there and how many we're still fighting off. All right, this next one is called river blindness, and this is also caused by a parasite. This one is carried by black flies, not by mosquitoes. And again, it is in tropical areas of the world. So we don't get a lot of these diseases in North America, especially in northern North America, because the mosquitoes and the black flies, they don't live here. They can't survive our cold temperatures. With global warming, they're expecting more and more of these diseases to start showing up in North America. All right, so parasitic worms are carried in the saliva of a black fly. The symptoms, it's an itchy rash where there's a bite, and then these parasitic worms kind of move through the bloodstream, and eventually they make it into the eyeball itself, and then they cause people to go blind. So it is the number one infectious cause of blindness. So usually blindness is not something you can catch. In this case, it's something that can be caught. All right, schistosomiasis. Say that fast, like 8 times. Schistosomiasis is caused by a parasite found in snails in infected waters. Again, if you have clean drinking water, you don't need to worry about something like schistosomiasis or river blindness or a lot of these. Leads to stomach pains, diarrhea, a cough, and depends which organ the parasite lives in, which symptoms you're going to get. So that'll tell you where the parasites are. All right, next is leprosy. Some of you may have heard of leper colonies. Those are quarantined where people who have leprosy are quarantined to live together. Leprosy is caused by a very, very contagious bacteria, and now we have antibiotics. So most of the time we can fight leprosy. It's a very, very difficult disease to fight. Sometimes it takes 6 months to a year of being on antibiotics before people are cured of their leprosy, but we can cure it. The problem is that not everybody has access to good medicines, and not everybody can take medicines for 6 months to a year. So we still have leprosy on this planet. It leads to numbness in the hands and feet, and then eventually people's fingers and toes fall off. Sometimes their noses fall off. And so I don't think it's super painful because you have numbness, but they're quarantined away from their families, and so they are forced to live away from their families for the rest of their lives. People with this illness were sometimes isolated in special colonies, so done with that. All right, dysentery. Dysentery is another diarrhea disease. If any of you have ever heard of a game that's called the Oregon Trail, I don't know if you ever played it in social studies class, but many of them died from dysentery. It's caused by eating infected food or water. It leads to severe bloody diarrhea and cramps. Some of you, if you've ever been to more rural parts of Mexico and you've been drinking the water, sometimes visitors to Mexico, and not usually the people who live there, it's the visitors, the tourists, they get something called Montezuma's revenge. That is dysentery. All right, rubella is known as German measles, sometimes more commonly. It's caused by a virus and it leads to a rash, low fever, and it usually passes within 5 days. So it's not a big deal, but we get a vaccine for rubella. So, why do we get a vaccine for something that's really not a big deal? That's because when pregnant women develop rubella, it causes severe, severe birth defects. And so we're trying to protect each other by getting vaccinated so that our pregnant women don't develop it. All right, filariasis. This one is very hard to look at. It's a parasite, again, carried by mosquitoes. It leads to extreme swelling in the legs or the genitals, and it can be called elephantiasis. Basically, the parasites get caught in the what's called the lymphatic system, which clears fluid out of your body. They get stuck in the lymphatic system, and then fluids start to build up. There are cures for it, but many people in our world don't have access to good medical care. And so that's why they might develop filariasis. Again, this is something that's in tropical areas of the world and not in North America. Tetanus is something that is definitely in North America, and hopefully all of you have been vaccinated against tetanus. Tetanus is a bacteria found in the soil, and it enters through deep injuries. So the classic example is if you step on a rusty nail, you might develop tetanus. But anything that gives you a deep cut, you need a tetanus vaccine for. And if your vaccination is not up to date, you need to get up to date. It causes severe muscle tightness and difficulty swallowing. So every muscle in this person's body is clenched. And what ends up often killing people is that their stomach is so clenched that they vomit. Only their mouth is stuck. They call it lockjaw. Their muscles on it, so they can't throw up, even though their stomach contents are coming up, and they end up inhaling their vomit and dying, basically drowning in their vomit. It's a horrible, horrible, horrible disease, and vaccines have pretty much taken care of it for people in North America. But again, people in the other areas of the world that don't get their vaccines still are dealing with tetanus. All right, rabies. Many of you are familiar with rabies. It's found in the saliva of infected individuals. It starts with fever and tiredness and leads to difficulty swallowing. You often hear that animals with rabies are foaming at the mouth. That's not always the case, but sometimes is the case. They get irritable, they get confused, they act erratically, and they're more likely to bite somebody. And unfortunately, humans have the same symptoms. It's not that they're more likely to bite, because humans don't usually bite each other, but they act erratically, they get confused, they can't swallow, and very scarily, is that a word? Rabies is pretty much 100% fatal. We have vaccinations so that if somebody does get bitten by an animal, you go to the doctor immediately, please, and they can help you with that. But if you avoid it and that animal did have rabies, it's pretty much 100% fatal. Okay, yellow fever is a virus that's carried by mosquitoes again, and look at who it impacts, people in tropical areas of the world. It leads to fever, headache, and jaundice. Jaundice is when your liver isn't functioning well. You may have seen somebody like this, and their skin starts to look yellow, and the whites of their eyes look yellow, and that's where the name yellow fever comes from. Muscle pain, nausea, vomiting, and fatigue, and a small percent develop a severe disease and then die from it. So there is a vaccine for yellow fever. We don't get it in North America. Okay, Zika, you may have heard of. We are starting to get Zika in North America. Florida has seen some cases of Zika, so our southern neighbors. It's a virus carried by mosquitoes. There are usually mild symptoms, so just like with COVID, just little things that people are not afraid of. Fever, rash, headache, not a big deal, joint pain, whatever. However, the reason that we would want to get vaccinated against Zika, or the reason we're concerned about Zika, is once again, it's the pregnant ladies. If a woman is pregnant with a baby and she develops Zika, there's a much greater increased chance of a birth defect that's called microcephaly. And microcephaly is when the brain and the top of the head don't form correctly. And so while that is actually a very beautiful child, she will be developmentally delayed extremely. Oftentimes these kids are blind and just unable to ever take care of themselves. And so it's a very, very severe and very serious serious infection for these babies. All right, necrotizing fasciitis, we're almost done. It's caused by the strep bacteria. So when you have strep throat, same bacteria. Only in this case, they've mutated and they've spread to other parts of the body. So usually people start out with a fever, but it's really from an injury. And then the bacteria get into that injury, and the injury becomes red, and then it blackens. And so maybe the injury is here, and then within a few hours, it's spreading, and you see redness and blackness spreading. That's necrotizing fasciitis. It's extremely rare. You're much more likely to get struck by lightning 10 times than you are to develop necrotizing fasciitis, which is good news. It often requires amputation of the affected body parts, so arms, legs. So it just depends what part of the body gets infected, whether they're able to cure it or not. And so it has a very, very high death rate. This bacteria is also known as flesh-eating bacteria. Okay, and I think this is our last one. No, maybe a couple more. I can't remember. Lyme disease. This is one we definitely get in Minnesota. In fact, take a look at the map. You can see that Minnesota is one of the hot spots for Lyme disease. It's caused by a bacteria carried by deer ticks, and look at how incredibly tiny these deer ticks are. These are not the typical kind of ticks that you might see your dog get. That you might. Many ticks are much bigger than this, but this, they often say it looks like a fleck of pepper. So that's the smallest. These are what are called the larvae and the nymphs of the deer tick, and they're just itty bitty bitty bitty. So early symptoms of Lyme disease are very mild: fever, headache, fatigue, and this bullseye rash. Not everybody gets the bullseye rash. Let me move so you can see that better. Not everybody gets the bullseye rash, but if you ever see that rash on yourself or anybody else, you go immediately to the doctor and you tell them about that bullseye rash. Because Lyme disease is caused by bacteria, it is very treatable. The problem becomes that many people don't get the bullseye rash, or they just don't notice their symptoms, and then the disease continues untreated, and the bacteria continue to reproduce, and then the long-term effects are sometimes permanent. So they can have joint problems, the heart becomes affected, the nervous system gets damaged, so they have pain or confusion, and some of those symptoms will never go away, even with treatment. So Lyme disease is real serious, and we need to pay attention. It's very common in Minnesota. Oh, this is the last one. I forgot. All right, Ebola. We've all heard of Ebola. At least I guess all of you have heard of Ebola. It's extremely rare. We've never had a real case of it in the United States, and that's because it's carried by fruit bats, and fruit bats don't live in the United States. They live in areas of Africa. And they're the ones that are carrying Ebola. So how do humans ever get it? Well, if they come in contact with the fruit bats, or they come in contact with their feces, whatever, there's ways that they can come in contact with it. Ebola has an extremely high death rate at 50%. And the way that you identify Ebola, fever, vomiting, diarrhea, muscle pain, and then sometimes, not always, most of the time, at the end of Ebola, when somebody is about to die, not like minutes, but just as they're nearing death, they start bleeding, and they bleed mouth, butt, ears, eyes, everywhere. Their body starts bleeding. And so that's called a hemorrhagic fever when that happens. And so that would be one of the symptoms. So Ebola. All right, ladies and gentlemen, that is it. Let me know if you have any questions.